The question number 1, the healthcare provider or RN or LPN admin the IV vancomycin to treat a patient who are methicillin-resistant Staphylococcus aureus infection, what we shortly call MRSA, right? So give the vancomycin, someone infection, but he or she is resistant to methicillin-resistant Staphylococcus aureus infection, MRSA resistant. So the medication vancomycin IV. So when you give the vancomycin IV to a patient, you always keep some information in your brain when you admin IV vancomycin. In our pharmacology section, we details talk about the vancomycin. And vancomycin is the antibiotic for any serious infection. It is the microbial drugs, antimicrobial is the way. What we have to need to know about vancomycin, vancomycin therapeutic index is very narrow. When any medication therapeutic index is very narrow, we could monitor the blood level of that medication. Otherwise, they causes some adverse effect or toxicity. Also, when you give any medication like vancomycin, we should keep in mind what are the side effects of vancomycin. Vancomycin can cause ototoxicity, means the hearing problem or renal toxicity, right? And also, vancomycin can cause sometimes infusion reaction, hypersensitivity reaction we call it, or they can cause phlebitis. Phlebitis means inflammation of the vein, because you are giving IV, means intravenous medication, and you already know that vancomycin side effect is develop phlebitis. Phlebitis means inflammation on the veins, right? So first of all, you are really good to take care of your patient and you have very good pharmacology knowledge. When you admin the vancomycin, we have to keep all of the information in the brain. So out of 5 options, what is the most appropriate for my patient? In this discussion, actually, we are going to learn something. It is not that you have to answer each and every question. No, we are learning, right? First of all, they said out of our first number 1, assess the client for a lethargy or decrease the deep tendon reflex. Deep tendon reflex is never ever related to vancomycin. It is related to the Maxsulf. Maxsulf we use for eclampsia patient, maternity. If the pregnant mother after the delivery or during delivery, hypertension crisis develop, malignant hypertension, that times we use Maxsulf and we check the deep tendon reflex. Number 1 is not related to this question. Number 2, we could access the skin and flushing and red rash on the face and torso. So we know that the side effect of vancomycin can cause the infusion reaction or anaphylactic reaction. An anaphylactic reaction is a life-threatening allergic reaction. So we have to check any kind of skin, rash, flushing of the facial skin, right, or redness, or in redness in any part of the bodies. It reflect the hypersensitivities or hypersensitivity reaction, whatever it is. Number 3, they said infusion medication over at least 60 minutes. So when any serious medication like vancomycin, it is serious, I called because they can produce a lot of side effect or adverse effect. So when you give the medication like vancomycin or injection KT or potassium, we could give it very slowly for, right? So infusion medication over at least 60 minutes, very slowly infusion. If you do any rash like within 10 minutes, 20 minutes, side effect will be more. What are the side effects? Anaphylactic reaction, inflammation, phlebitis, right? And also we know vancomycin therapeutic index is very narrow. So monitoring the blood pressure. Why blood pressure? Because the patient chance to develop hypotension. Another reason we should be stay with the patient. We give the patient very slowly and observe to see any kind of infusion reaction, any kind of inflammatory change, any kind of develop phlebitis, or later on we can check kidney function to see renal toxicity. Also observe IV site for 30 minutes for inflammatory reaction, right? What is inflammation? It is the condition characterized by inflammatory process, right? So, and other things is the inflammatory response means redness, pain, tenderness, and swelling. So just observe and see. What is their explanation? So when admin IV vancomycin, the nurse should assess the fall and work to prevent possible complication. What they are means monitor the blood level of vancomycin. So therapeutic level, right, or therapeutic index. So vancomycin level range 10 to 20 milligram. This 10 to 20 is therapeutic index or therapeutic level. So what does it mean? Vancomycin do not work if we give less than 10, and if you give them more than 20 milligram per liter, they are toxic. And this is the ideal range where the vancomycin work the best. So the adverse effect of vancomycin toxicity include nephrotoxicity as well. So how we can find out the vancomycin can cause renal damage or not? Just check the serum creatinine level, and BUN is the marker of kidney function. Also, we could check the hearing loss, vertigo, tinnitus for ototoxicity, the side effect of vancomycin. Infusion the medication over at least 30 minutes. So faster rate increase the chance of complication like phlebitis, anaphylactic reaction, or inflammation. check the blood pressure, monitor the blood pressure level. So hypotension is a possible adverse effect. Also see hypersensitivities, means the flushing or any skin rash like maculopapular rash, flushing under the facial cutaneous supply. Monitor for anaphylaxis. Anaphylaxis monitor reflex by pruritus, means itching, skin rash, or swelling of the laryngeal area and develop the edema, and patient develops shortness of or difficulty of breathing or wheezing. It means the hypersensitive reaction is occur. Also observe your patient for at least 30 minutes to see any kind of complication. So complication what? Pain, redness, swelling. Vancomycin is a drugs that also causes thrombophlebitis that we already explained, right? So now little bit education objectives here. Let me read it for you. Nursing care of a client receiving the IV vancomycin include draw the prescribed level of vancomycin before drug admit. Infuse the drug over at least 60 minutes. Monitor the client during administration, means side effect monitoring, respiratory status, sign of hypersensitivities, and check the local areas, IV site during or after administration. Question number 2. So why in this discussion, basically we are learning about a topic. It doesn't mean the answer correctly or not, but we are learning, right? So a obese client with a diabetic who had a bowel resection 5 days ago. So what are the key points? Key points are patient is obese and diabetic, and also done the bowel resection. Now patient complaining to you, I felt like I split open, I mean the suture line is open when I do coughing. So when you do the coughing means you are putting the pressure on the lower part of your body, and it is because of constant pressuring the suture line will be open up, right? It's very common. So good education, good posturing, and good care is very important for the patient in post-operative states. During the assessment, the nurse noted that the incision edges are separated and loop of bowel is protruded through the wound. It is already came out. So if any content excision or any intestine is thrown out in surgical line or wound, it is called evisceration. So which nursing action would be appropriate? So if your patient condition look like this clinical scenario, what we could do? Number 1, admin 1 oral tab of oxycodone. So if patient do not complain of pain, we do not need to give them any medication. But if patient complain, as prescription we can do. But if you go and read this question, patient do not tell any complaint about the pain. So this is not a choice. Second, they said assess a full set of vital. Yes, we are RN, we are LPN. when any complaint patient do or any change of patient occur, we always check the vital sign. If the vital sign within the normal range, it indicates your patient is stable. If vital sign is fluctuating, means the patient condition anytime get worse or deteriorate. So vital sign check is the first priority. Cover the viscera because it is already extraction. It came out, so it is always covered with sterile dressing, saturated normal saline. So there are two options. When you cover it, the organ will not expose to the air or environment, and saline also keep it moist, give some oxygen. Notify the healthcare provider. Obviously we do this, and place the client low polar. Means when patient is low polar with the knee slightly flexed, it means the reduce the pressure, right? In this two picture showing wound dehiscence and wound evisceration. What are the difference between these two pictures? In case of dehiscence, it is separated, and the picture number 2 also separated, but difference between the content did not came out. So dehiscence means separation or splitting open the layers of the surgical wound, but the content not came outside. It is dehiscence. Evisceration, the separation or splitting open the layer of the surgical wound, and also internal organ or intestine extraction. It is called extraction of viscera or intestine through out through a surgical wound. Right? This is the difference between these two. Okay, so easy to remember. The evisceration started by E, the organ is extraction throughout the body, right? So dehiscence not like this. What next? Total separation, let me read it one more time. Total separation of the wound layer with protrusion of the internal viscera through the incision is known as evisceration. Evisceration is a medical emergency that can lead to localized ischemia. Ischemia means when blood supply reduced, the local tissue damage, right, and ischemic change occurred, or develop the peritonitis, so inflammation of the peritoneum. Both of them lead to develop the shock. Emergency surgical repair is very necessary. The client at the risk for poor wound healing. So who are under the risk to develop poor wound healings? Who are obese? Who have a diabetic? If you go back in the clinical scenario, the patient obese, the patient has a history of diabetes mellitus, right? So they are already under the risk. What other education objectives we could learn from this question? When an abdominal wound evisceration occurs, the nurse should take the following action: remain, claim, and stay with the client. So any kind of emergencies, always we could stay with the patient. We can call other co-worker for the help, and the same time someone notify healthcare provider immediately and bring the sterile supply because it is open up. Then always patient complain during the cough, pressure is go down, so tell them not to cough as possible. Place the client low polar. Why low polar? To reduce the pressure. So to relieve the pressure on the abdominal incision and have the client maintain absolute bed rest to prevent the injuries. Also, we measure the vital sign every 15 minutes to detect possible sign and symptom of shock. What are the sign and symptom of the shock? Develop hypotension, and when patient blood pressure drop, pulse go up. So when you see the hypotension, patient develop tachycardia or tachypnea. In case of evisceration, when organ is came out, we cover it with a sterile dressing gauze, what is saturated by normal saline solution to prevent bacterial invasion and keep exposed the viscera from dying out. Whatever we do, we always keep the documentation. So documentation intervention take an appearance of the wound and also evisceration organ. Like we can check the color and drainage. The good organ should be red, but if it is ischemic change, it will be change the color. If the blood supply is interrupted, the protruding organ can become ischemic and develop the blackening, and this is called necrotic. So if we see our patient condition like this, open up or viscera came out, first responsibility, tell your patient not to take anything by mouth. And it's called NPO status. So the client should immediately be made NPO, nothing by mouth, in prepare for emergency surgical operation. But we can admin IV analgesia, right? In a short, what we discuss here and what is our education objectives in case of any emergency management in the scenario like this, stay with your client and have someone bring the sterile supplies, notify healthcare provider, and make the client nothing by mouth and preparing for any kind of emergency surgery. And place the client low polar position, knee should be flexed, cover the viscera with a sterile dressing suture with a normal saline solution. Also, assess the vital sign and monitor for sign of shock. In the question number 3, we are going to learn some very basic information and important information about Stevens-Johnson syndrome. This question asking about the Stevens-Johnson, right? So a nurse is caring for a client admitted to the intensive care unit for severe Stevens-Johnson syndrome. Stevens-Johnson syndrome, other name is called toxic epidermal necrosis. Which intervention should be included in the client care? Select all. But I said in this question, we are just going to learn how to take care of patient in ICU who diagnosed by Stevens-Johnson syndrome. Stevens-Johnson syndrome here are very uncommon, a serious disorder of the skin and mucous membrane. It is usually a reaction to the medication or any reaction. Often it begins with a flu-like symptom and followed by a painful red or papules-like rash that is spread and blister formation. So why Stevens-Johnson is very important? Because Stevens-Johnson syndrome sometimes occur because of drugs. There are some particular drugs can cause Stevens-Johnson syndrome. So the drugs that can cause the Stevens-Johnson syndrome include like anti-gout. So if anybody is diagnosed by the gout and you give them anti-gout medication such as allopurinol, can chance to develop Stevens-Johnson syndrome or toxic epidermal necrolysis. What else? What are the other medication can cause Stevens-Johnson? The medication to treat for the seizure or mental illness like anticonvulsant or antipsychotic has a chance or risks to develop the Stevens-Johnson. Also, sometimes when patients undergo the radiation therapy, chance to develop the Stevens-Johnson syndrome. So I'm saying Stevens-Johnson is a life-threatening condition. When you deal with the patient, how to deal with them? First of all, admin the prescribed eye lubricant on schedule, right? And also apply the warm compression gently to the denoted skin. So in case of Stevens-Johnson or toxic epidermal necrosis, the skin or mucous membrane is tear up. This is the reason we could take care of the patient, the skin, and give them some eye ointment. So eye care is important. So cool, damp clothing are applied to relieve the burning sensation. Eye lubricant is applied to reduce the dryness and prevent the corneal abrasion, right? And also what next? They said, apply the warm compression gently. Also implement the reverse isolated precursor. So why isolated? If the other patient has infection, this infection easily to spread over with the toxic epidermal necrolysis patient. Leave the blanket off. Why? Because hypothermia also a problem of this patient. So you have to prevent the temperature. So why blanket off? We do not do this, right? And pain management is also important, right? So they said toxic epidermal necrolysis, shortly called TEN, or other name is Stevens-Johnson syndrome, acute keen disorder, most commonly associated with medication reaction. The result is widespread erythema or erythema, blister developed, epidermal shedding means removal the epidermal layer of the skin. In the eye, keratoconjunctivitis, conjunctiva inflammation, ulcer develop in the eye, or skin erosion, removal, peeling out denoted skin. It is a more severe form of Stevens-Johnson. So more severe form is called toxic epidermal necrolysis syndrome. As I told you, they often begin with a fever or flu-like symptom, such as cough, sore throat, tenderness, tiredness, and general ill feelings. The major cause of death related to TEN is a sepsis. This is the reason isolate your patient. So prevent the infection is most challenging. What the other basic support for your patient? Wound care means warm compression apply. Infection prevention means isolate the patient, hand hygiene, strict the sepsis procedure, means you have to follow universal standard precursor at least. The nurse should also monitor for early sign of infection. What are the early signs? Increase the temperature, fever, or change the vital sign. Promote the fluid and nutrition to prevent dehydration, to prevent to develop hypotension. Vital sign and urine output are monitored for sign of hypovolemia. Hypovolemia lead to shock, and shock lead to death. Oral feeding should be initiated early to promote wound healing, hypothermia prevention. So no need to off the blanket. Pain management, give the analgesia usually admin around the clock or as prescribed. Eye care is important to prevent the dryness and redness and prevent the corneal abrasion. What are the educational objectives from this question or about the Stevens-Johnson syndrome or toxic epidermal necrolysis? Is a serious condition that causes the large area of erosion of the skin or denoted skin and also in mucous membrane. Care is supportive, focus to prevent the complication, including management of sepsis, give enough fluid, monitoring the electrolyte imbalance. Ophthalmic care is important and also prevent hypothermia. So this is the very basic and important information about the care of the patient, what every nurse should know.